Our chief guest, our Principal Secretary, State Department for Public Health and Professional Standards, Madam Mary Muthoni. His Excellency, the Ambassador to Denmark, Stefan, the Vice Chair, the Board of Novo Nordisk Foundation, last month, plus the teams accompanying them, our partners, CHAC, KCCB, NCD Alliance, AMREF, APHRC, CEO, management, and principals and staff, our chair, our board of directors and directors present here, ladies and gentlemen, our students who are also gathered here. I want to welcome you here. We have gathered for a good reason. It is a great day to come here and celebrate as well as tell some success stories. Now, if you go to a hospital, which I know all of us have gone, the first thing they ask you is your name, and they ask you your age, they ask you where you come from. They also ask you why you have come. So at KMTC here, I want to say we are Kenya Medical Training College. This is a current campus, and the principal has told us current campus began about 60 years ago. So their age is 60. And we have seen their impact. We are seeing the alumni represented here. KMTC as a whole has been here 98 years since 1927. And today we have a big milestone as we come and join current campus, which is a center of excellence in training for nutrition and dietetics. Today, together with our partners, we want to talk about successes and the next steps regarding cardiometabolic diseases and nutrition and dietetics. Now, what is cardiometabolic disease? Now, this is a group of diseases that have similar risk factors. Like heart disease, the affected brain, liver, muscles, diseases that can affect children, adults, people of all ages. And at the end, you end up with the heart problems, severe heart problems, including heart failure. You also end up with kidney problems, very severe kidney problems. So there are a group of diseases like that, and their risk factors are known. So I want to then say, as we discuss the going forward, as we discuss what we plan to do to strengthen nutrition and dietetics, the impact on cardiometabolic disease, let's also look at what are the success stories that we can tell about the strides that we have made. The principal has mentioned some of those strides. But I want to then ask us, let us build a legacy on those. Today we are very happy to have all of you, and at the end, I know we'll have collected, you'll have had notes about several different things around cardiometabolic diseases. I want to know it's going to be fruitful and useful. And now I want to welcome our CEO to take it from here. Welcome.
It is an honor to welcome you to this celebration of a landmark achievement for Kenya Medical Training College, particularly the current campus. Madam PS, your presence today underscores the steadfast commitment of the government and partners to advancing healthcare and education in Kenya, particularly our collective mission to achieve universal health coverage. Our vision is to be a globally competitive institution for training human resources for health. And our mission is to develop fit-for-purpose human resources for health through transformative training, research, and consultancy. With 88 campuses spread across the country, KMTC remains a cornerstone of Kenya's healthcare workforce development. Madam PS, this grant aims to establish KMTC Karen campus as a center of excellence in education and training for dietitians and nutritionists on cardiometabolic diseases, exemplifies our commitment to excellence. Madam PS, by incorporating the prevention and management of cardiometabolic diseases into nutrition and dietetics curriculum, we are ensuring that our students and graduates are equipped with the latest knowledge and skills to address this critical healthcare challenge. Furthermore, the grant will support infrastructure development, including upgraded classrooms, laboratories, libraries, and providing students with a world-class learning experience. The alignment of this initiative, Madam PS, with KMTC's strategic plan and Kenya's universal health coverage framework is clear. By producing highly skilled health professionals, this project will enhance the quality of care for non-communicable diseases and strengthen healthcare systems' capacity to meet the evolving needs of our population. I want to extend my heartfelt appreciation to Novo Nordisk Foundation for their generous support, and to the African Population and Health Research Center for their invaluable partnership. I thank all stakeholders whose dedication has been instrumental in advancing KMTC's mission. Together, we are shaping a healthier and brighter future for our country, Kenya. I want to extend appreciation and gratitude to the country steward of health, the Ministry of Health, represented here by my boss, Madam P.S. Mary Mudhoni, for the unwavering dedication to raising healthcare standards and fostering the training of skilled health professionals. It is now my honor, Madam, to invite the board chairperson, KMTC, Mr. Josiah Cheriot, to give his remarks.
Today, we gather to celebrate a momentous occasion for the KMTC and Kenya's healthcare sector. The announcement of Kenya current campus grant by Novo Nordisk Foundation is key for us. On behalf of Kenya Medical Training College Board of Directors, I express our gratitude to the foundation and our implementing partners, the African Population and Health Research Center, for their trust and support in this transformative project. These initiatives aligns with Kenya Medical Training College strategic plan to develop fit-for-purpose mid-level health professionals through transformative training, research, and consultancy to address emerging healthcare challenges. By enabling KMTC current campus as a center of excellence for education and training in cardiometabolic diseases, we are taking a significant step toward realizing our vision of being a globally and competitive institution for training human resource for health. The grants focus on curricular enhancement and infrastructure improvement directly supports Kenya Medical Training College's strategic objectives to improve the quality of training and create a conducive learning environment for our students. These improvements will not only enhance competence of our graduates, but also position KMTC as a key contributor to Kenya's universal health coverage goals. I extend my heartfelt gratitude to the Ministry of Health, our mother ministry, which is represented here by Principal Secretary Mary Mudhoni, for fostering a collaborative framework that enables KMTC to excel. Above all, we express our deepest appreciation to His Excellency, President Dr. William Samoei Ruto, for his visionary leadership and steadfast commitment to improving healthcare services in our country. Kindly let me invite the ambassador to make his remarks. Thank you very much and God bless.
Good morning. Very little of this would matter if we didn't have outstanding students at this and many other schools working hard every day, graduating soon, and getting out there to make a difference. Thank you. So, for me as ambassador, Denmark's ambassador to Kenya, it is a great honor being here and being at this very spot. So while KMTC Karen started out with, 40 students 60 years ago, it is now several hundreds. It is amazing. Together with Honorable P.S. Mary, we are still today doing what we can, trying to support the government's effort to improve health services. And we are in fact doing it at clinics, dispensaries, more than 6,000 places as we speak in 47 counties. It's a strong partnership, and we appreciate everything that we are doing together. Now turning to the Novo Nordisk Foundation, or as we say, often just NNF. I firmly believe that at a time where everything is a bit bumpy, where the world heading, what's going to happen, we all need to think about new ways of moving forward, new types of partnerships. What Novo Nordisk is doing with you and with many other actors, institutions and partners here in Kenya and other places is important, because they show us that if we work together, we can move things, of course, with a strong focus on health. We have already heard about the cardiometabolic diseases and the need to prevent them. But this work is important. And seen from my side, from our side, we are impressed with the work that NNF is doing. So let me wrap up by once again appreciating the partnership between Denmark and Kenya within health, by praising the partnership between KMTC Karen and NNF, by appreciating the presence of P.S. Mary, and by thanking all the students for being extremely disciplined, listening to all these old people. Well done. Thank you. Have a nice day. Yeah? And now I think it is time, in fact, to ask Lars Munk to join us up here.
It's an honor to be here today as we celebrate a milestone in our shared commitment to improving health outcomes in Kenya. Today we announce the recipient of a new grant to the Kenyan Medical Training College, Karen Campus, which will support their ongoing work under Partnership for Education of Health Professionals, PEP, as has been mentioned before. At Novo Nordisk Foundation, our mission drives us to reduce inequities in health, promote sustainability, and improve the quality of lives for people living in vulnerable situations. In line with this, we are proud to support the PEP program, which aims to equip further healthcare professionals with the skills needed to manage the growing burden of CMDs or cardiometabolic diseases. KMTC has been a cornerstone of Kenya's healthcare system since its establishment, the healthcare system in 1926. As the largest government-owned medical training institution in the country, KMTC operates an extensive network of campuses and trains over 12,000 students, out of which a lot of you are present here. Annually, KMTC plays a vital role in addressing the country's healthcare needs, particularly in underserved regions. Institutions like KMTC are key to reaching vulnerable populations, ensuring access to quality healthcare. This supports the government agenda for achieving universal healthcare coverage. The work that KMTC is doing under the PEP program is nothing short of transformative. By focusing on building the capacity healthcare workers to manage CMDs, KMTC is preparing the next generation of healthcare professionals to confront the rising tide and the rising cardiovascular disease burden, like diabetes, like obesity. These healthcare challenges are often preventable, but they require an informed and very well-trained workforce to tackle them. This is why the role of KMTC is so utterly important. The partnership between NNF and KMTC is more than just a financial support. It's more than just a financial support. It's a partnership and investment in long-term systemic change. The collaboration will not only enhance the education and training provided to healthcare workers, but will ensure more healthcare professionals are prepared to meet the growing demands of CMD prevention and care. By strengthening institutions like KMTC, we can help ensure that mid-level healthcare professionals, those actually often closest to the communities they serve, are well equipped to provide high-quality care. Once again, I would like to thank the government of Kenya, the Ministry of Health, and our partners for their dedication to this cause. We look forward to the positive impact of this collaboration and to helping KMTC train their healthcare leaders of tomorrow. Let's continue to work together to make the world's place where innovation and compassion drive real, lasting change. Asante sana.
Today, as we celebrate this transformative grant from Novo Nordisk Foundation, which signifies a very key step in Kenya's pursuit of universal health coverage. And this occasion underscores our shared commitment in advancing health outcomes for all Kenyans. And I am delighted to witness this impactful collaboration. Indeed, I am not even sure I deserve to be called a guest. I'm part of the community. So this is part of me. Really, we are just celebrating as a community and equally as a society. Ladies and gentlemen, the ministry acknowledges and appreciates the invaluable role that is played by KMTC in addressing the nation's human resource for health gaps. In the recent past, you have seen the government, maybe for those who do not know, health is one of the 5 key agenda items that are in this government's focus. Amongst the 5 is health, agriculture, MSME, digital economy, and housing. Therefore, it is very important to note that even the ministry is taking this as a bold step into the future. And the very first thing that the ministry did was to create a foundation, to build a foundation, a firm foundation. And there is no foundation that comes without a structure. Enactment of follows that will see us move to better and bigger spaces. The Digital Health Act of 2023, the Social Health Insurance Financing Act of 2023, the Primary Healthcare Act of 2023, and the Facility Improvement Financing Act of 2023. I am sure, Your Excellency, as you go around the 47 counties, you're going to feel the change because of the Facility Improvement Financing Act that is ring-fencing all funds that are meant for health. There is no reallocation. If you give me a donation, it will stick to health. If you bring money to KMTC, we are not going to reallocate for any other function. And really that is what we want to see, so that we don't have to procrastinate on every other problem that has been there 60 years ago, 90 years ago, when KMTC was being established. Therefore, today we turn our focus to cardiometabolic diseases. And this category encompasses preventable conditions such as heart attacks, strokes, diabetes, kidney disease, non-alcoholic fatty liver disease, and these conditions represent a very significant global health threat, now ranked as the leading cause of death worldwide. On behalf of the Ministry of Health, I want to commend KMTC and the leadership, Chair and CEO, and equally the African Population and Health Research Center for their visionary leadership in the initiative. Your dedication in advancing the health education and training is truly commendable. I extend my heartfelt gratitude to Novo Nordisk Foundation. And Lars, this is not the first time you're here, and it's not the last. As we launch this initiative, let me reaffirm our commitment to working collectively to strengthen our healthcare system, to empower our health professionals, and ultimately improve the health and well-being of all Kenyans, because together we must create a healthier and more prosperous future for our nation and for our people. Thank you, and God bless you all.